everyone. It's a pleasure always to be in this building where so much happens. And it's on us to really make it happen after these conversations. So I love how Enrique opened up, challenging us to do more than talking. All right. But I have an amazing new friend, if I may call you like that, Ms. Reshema, who's joining us. Reshema Kemps-Polanco is the Executive Vice President and Chief Commercial Officer at Novartis US. And she's responsible for the expansion of medicines across oncology, immunology, neuroscience, cardiovascular, renal, and metabolic diseases. A lot of lives in your hands, and we are so grateful for your leadership, Reshema. She is certainly a purpose-driven leader, sits on different boards and organizations, but let me highlight two in particular. So she is on the board of directors for the Charles Rivers Laboratories International, as well as the Healthcare Leadership Council. But not too long ago, she was named by the Business Women's Association as the 2025 Woman of the Year. So yes, let's give a hand to that. And my first question, once I have this great conversation with Reshema, will be for her to tell us a bit more about what she's up to and what she's working on, because my intro certainly doesn't do it justice. So Reshema, we would love to have you here on the stage. Thank you for joining us. We're going to see how we turn ideas into action. Yes, let's give her a hand. Thank you. Okay. Tell us about you, Reshema. Welcome, first and foremost.
First of all, thank you for that lovely introduction, and thank everyone here for having me. It is wonderful to be here in such a forum. It's interesting. I meet so many people, and they say, "What is a chief commercial officer?" And I've tried to explain it so many different ways, and so I'm going to test it out on people here. So as you heard, I am responsible for the expansion of medicines across a multitude of therapeutic areas at Novartis. We have decided to focus on 4 key therapeutic areas where we will develop deep expertise, and we plan to be committed in these areas for years to come. And my primary job is basically a part of the innovation chain. So if you think about R&D, the drug development, right, we go from discovery to drug development. We always say you need a strong R&D machinery, but if you cannot get those medicines in the hands of the patients who need them post-approval, then what is that innovation in service of? And that's really where my role comes in. Thinking about my team starts to work with drug development very early on. And I heard someone say here on a panel about understanding patients' lived experiences. So that's one of the things that we take very seriously, is understanding the insights very early on, making sure that patient voices are heard, their lived experiences are considered within the drug development process. We call them non-clinical barriers. So there are clinical barriers to gaining access to medicines, but there are also non-clinical barriers that stand in the way, and that's where the healthcare disparities really start to play a role. So we try to bring all of that into commercialization so that when a medicine is approved, we can serve a multitude of populations with equity and at scale.
I love that. So I'm sure this room knows this stat, but it's one of those that I'm obsessed with, and you just kind of make me think of it. Let us not forget that 80%, as high as 80% of health outcomes are driven by other things that are not medical care or treatment. To your point on the social determinants of health, yet many times in our organizations and in the way just the health economics have been working to this point, more than 80% of our spending goes into medical care and treatment. Therefore, there's something there, some opportunity. And it sounds like that's a lot of what you're working on at Novartis, which is incredible. Now, the world is a very dynamic place. Let's just leave
That's
it.
an understatement.
Never a dull moment
Not for
in
the
today's
faint of
world.
heart. Yeah.
Yes, yes. But as business leaders, we have to stay focused on the mission, continue to put patients at the center. I love that Dr. Mike gave us, again, the fundamentals of patient at the center. But what has it been like as a leader in your role in pharma, and I'm sure we can all relate in this room to this question, what has it been like in the last year or two in navigating the economic, geopolitical, just tensions or landscape or changes, whether it is new policies, executive orders, the public discourse? Just give us a lay of the land of how that is impacting you or how you're leading through it.
Yes, I think more than ever for leaders in any industry, and particularly in healthcare, the ability to lead through complexity is incredibly important. And those complexities change over time. So right now, all the things that you named, right, are some of those complexities. But if we really think back over, say, the last decade, there's always been some type of complexity you've had to navigate. And so I always think in, how do you manage polarities? And this is one of the things that we really focus on with our leaders, because the world is not binary. And I think this is part of the problem, is that very few things are this or that, right? It's usually some gray in between. And part of the thinking, I say one of the things that frustrates me at times is that there are very few solutions or thoughts that are all right or all wrong, right? They are nuanced, context-driven, and it is up to the leaders and the leadership to understand, where do you bring in judgment? Who are the stakeholders that have to be navigated? How do you think about the vantage points of each stakeholder? And how do you do the greatest good for the greatest amount of people? And this is not something that's going to go away. And so I tell my teams, if you're waiting for this to be over, it was kind of like how people were waiting for COVID to be over. But the world has not been the same, right? And it's not going to get easier, and it's not going to be the same. And so it's funny, I heard this from, I think I heard it from the head of the women's basketball team at Duke University. She has coined this term, do harder, better. And this is how, I start to think about, how do we navigate these different things? And so where do you find the common ground, right? And how do you keep your true north? And so it takes a lot of resilience. And the definition of resilience is really founded in, how do you maintain your core purpose when the circumstances around you are changing dramatically? And so we have to keep our North Star at Novartis. I have to keep my North Star as a leader to say, when I think about my purpose and why I exist, what will be different because I was here, my team was here. For me personally, it is, how can I contribute to democratizing outcomes? And so if you think about, there's health equity, the word equity is like, it's very polarizing in today's environment. I more think about the outcome, right? So equity in service of what? Where we're really trying to go, and I think everyone can agree with this, is how do you democratize outcomes so that where you live, your geography, and if you're in the US, your zip code, doesn't determine if you live. And it is just that simple. And I think that is something that we can all get behind, because, like I heard earlier, it includes everyone. There are inequities in rare diseases. If you think about that, it doesn't matter how much money you have. If that disease isn't being researched by industry, it doesn't matter. You can't buy your way out of it. And so sometimes there's an inequity there. There's an inequity in marginalized communities. There's an inequity in men's health. If I just think about, we're in the space of prostate cancer. There's an inequity that is driven, that's multifactorial. I think about my son, I think about my husband, and I'm always running behind him about, have you gotten your PSA checked? What did the doctor say? And I went to the doctor with him not long ago, and the doctor asked me, do you actually want to come in here with him? I said, no. But this is how, this is how important this is to me. And so I think about the inequities of women in certain immunological diseases. And so if you add it all up, it's everybody. But it affects everyone differently, and understanding those lived experiences helps us to commercialize those medicines so that we can get those medicines to patients at pace.
I love it. So everybody, quotable moment, whatever platforms you use, there you go. Do harder, better.
I didn't say it, actually.
I know, but let's attribute it, with women's coach from Duke. But I think in one way or another, we can all borrow some of your purpose of democratizing outcomes. Because that is, and I know you mentioned common ground, but it's almost like a higher ground.
Yes, it is.
Common is like almost each side has to give up something to get to common, but higher is undeniably shared.
I love that.
So democratizing outcomes. Forget about the language. What was it that we were hearing before? Call it an artichoke, call it whatever. But ultimately is democratizing outcomes. I'm loving this already. Okay. The next question kind of leads into this because, okay, in that pursuit of democratizing outcomes and the very essence of what a chief commercial officer does, now we know, it really is like bridging all the way from like lab to human.
Absolutely.
From innovation to impact and outcomes.
Yes.
So what else can we do for bridging that path from innovation or R&D to access? And a forum like this one and public-private partnerships, how do they play a role? How do you see it working? How is that working in your role? Just give us some ideas.
Yeah, it's a great question. The one thing, and if I speak specifically to the market I'm responsible for, which is the U.S., one of the major problems in the U.S. healthcare system is the fragmentation. And so if you are a patient who's been diagnosed with cancer or any other serious condition and you're trying to navigate the fragmentation in the healthcare system, it really slows down access to treatment. And so where the public and private partnerships come in is that no one entity can solve it all. And this is where the complexity comes in. We tend to talk about problems. Is it a complicated problem or a complex? And complicated, typically, it's predictable. You can figure it out. You can solve it. I fixed it. I don't know that there is a fix. We've been trying to fix the healthcare system for decades. But it is, how can you navigate it successfully? And how can you have more patients navigate it successfully? And everyone has a role to play in that. Whether it's the pharmaceutical industry, the healthcare delivery systems, the hospitals. And we see that with the rise of telehealth, right? That really took off during COVID out of necessity. But think about the democratization that allowed if you didn't have a car, if you have transportation insecurity, right? Childcare, all of those things. It's a great example of we had to do it under duress, right, as a nation, and it really accelerated, and I'm glad that it continues to be an option for patients. But I think continuing to understand where does private sector come in, what role does government play in contributing to research and partnerships around very serious diseases. What roles, another example was I remember, a lot of the transportation companies were giving people rides, right? This is non-traditional when you think about it. One of the things we've even learned in our clinical trial settings is we have to not only think about how we write the protocols for clinical trials, but thinking about those barriers that need to come down that are non-clinical. How are the patients going to get here, right? And so, thinking about what partnerships do we need to strike, and then policy plays a big role. Because that's really at the top of the funnel, right? What are the policy and what are the laws? If you think about right now in breast cancer, I'll give you a great example. I'm very proud of this. It is very personal to me. I lost my best friend to metastatic breast cancer during COVID. She was only 48 years old, lost too soon at the height of her career, just an amazing, amazing human. And watching her navigate, and she had the means, and it was difficult. I had to help her navigate. It was difficult. And she always said to me, what if I didn't have the means? How much harder is it? And I remember there was a woman there that she met who could not did not have a way to get to chemo. And she paid for her chemo anonymously. So this woman could get in, and that was really, hearing that story was really eye-opening to me. And so the company is really committed in this area. We have been in breast cancer for a really long time. And so we have a program called Your Attention Please. Many people probably watched it and watched, if you watch American football, you watch Super Bowl, we were super proud of that. And that was really because we're seeing too many young women who don't necessarily meet the thresholds for when you should start getting mammograms. But we're seeing too many young women who are diagnosed with breast cancer, and a good percentage of them, it's already metastatic. That should not be, right? And so this is really around how do you get more women screened? How do you start to make sure that women who are younger, who maybe have a family history, or there are cultural elements to the natural history of the disease, start to think about screening and driving that family conversation. Someone said that earlier. Are the kids asking the parents, have they been screened? Are the partners asking their wives or their partners, have they been screened? And so that's one. We've seen really, really good momentum behind that one. But then that's not good enough. So you have the therapeutic, you do the research, you have the therapeutics, you want to make sure people are getting screened, but you also have to have the policies. And so we've really partnered with a number of advocacy groups for what we call the ABCD Act. And it's the Alliance for Breast Cancer Diagnosis. And this is really around, one of the findings that we have is many women have dense breasts, and many times these are younger women. And they don't have the insurance access for the additional screening. So maybe the mammogram, but not the additional ultrasound, which would really detect some of these cancers earlier. And so really helping to shape policy along with advocacy. So there you have the private sector, you have policy, government, and you have advocacy working together to get more women screened and hopefully save more lives.
There you go. That is at the center of, when you see those little colorful tiles there, the SDGs, that's number 17 right there. Public-private partnerships. Very, very well stated. Which is why we're here. Because there's so many gaps and challenges, and there's opportunities everywhere we turn. I will say again what you heard in the opening remarks. Please make sure you meet at least one person that may be placed into that ecosystem that Reshema just mentioned, whether it is a system, a hospital system, or a payer, or government, public affairs, or industry, like those of us that come from pharma or are in pharma. We need all of us rowing together. Okay, so when there's so much to tackle, that I love the complexity or the complex, right? How do you decide where to focus? Like, for example, in your portfolio with all those therapeutic areas, like, how do we get started?
Right. So I think, from a corporate strategy, we focused on those 4 therapeutic areas that you named in the beginning: oncology and immunology, neuroscience, and then cardiorenal metabolic. And I always think about, where do we have the right to win? And I don't say it like it's a game, because people's lives are not games. Sickness, it's not a game. But it is, where do you have the right, and you're going to stay, and you're going to sustain, and you're going to stay in it when you have failures, and you're going to learn from those failures, and you're going to try again, you're going to do the next trial, and you're going to stay, and you're going to go deep, and you possess that expertise you're uniquely positioned to make a meaningful difference for patients, their families, and society. So we've chosen those 4. So that gives you some focus. But then the task is always underneath those 4. What are the diseases, right, where you really want to prioritize and focus? And so, I try to think about with my team every day. First of all, I have to say, my team's working, so they're not watching this, but people will tell them, I am so blessed with the privilege of leadership. I work with some of the most amazing people on the planet. You know one of them. One of my peers, and then my therapeutic area heads who lead these areas, they are personally and uniquely connected to these therapeutic areas. And it's really around where do we have the greatest opportunity to derive the greatest benefit on behalf of patients? And we have to do that also with a polarity of and ensure a good return to shareholders. So we hold that because that's how you have a sustainable business, right? And so, we focus there to say, well, can we have the greatest impact? And something the team shared with me yesterday, and I said, can I say it today? Because I loved it so much around, going first. We are a company who will go first. We're a company who will go farther, and we're a company who will go together. And when I say go first, a great example is pioneering in the space of cell and gene. There was a little girl, she is not a little girl anymore, she's in college now, her name is Emily Whitehead, and she was one of our first patients who was treated with cell and gene therapy, CAR-T. And since that time, and that was done in a collaboration with Penn, since that time, the number of companies that have gone into the space of CAR-T, it was hard, it was pioneering, we stuck with it, inspiring other companies to go into this space, and now we're looking at CAR-Ts to treat immune-mediated diseases, and I hope that we'll be successful, but we went first there. The next area where we've gone first is radioligand therapy, and to make this really simple, this is what you call, this is a therapeutic and a diagnostic or imaging agent in the same, combined together, meaning that if you have an imaging agent, you can attach a therapeutic to it. And what it allows physicians to do, very simply, if you can see it, you can treat it. And many times micrometastases exist, but you can't see it, right? And you see recurrent cancer come back. So in the space of NET tumors and prostate cancer, we've really been pioneering in that space. And now we've seen several other companies have come into this space. And I always welcome competition. I mean, it's up to us to say whose product is going to be better. But I always say competition is great for patients because iron sharpens iron, meaning that each company is going to fight to have the best next medicine. And patients want that because each one will keep lifting the other, right? And you'll have a multitude of treatment options because no one medicine is going to treat 100% of the patients. And so you hear my passion. That's why I love this space so much. And we, our CEO will always say, we take moonshots here. And occasionally you hit the moon, and it is amazing when you do. I've sat in, I don't know how many of you have attended ASCO. It is the premier, I would say, cancer congress where all of the new data, science comes out. And I have never sat in a place where I would see tears when you see a Kaplan-Meier curve and you see people will say, you can drive a truck through that curve. That means life will be extended if that medicine's approved. And there is no feeling like that. And so, yes, the innovation in terms of, you asked me a question, I've gone a long way around where to focus. It's the ability to focus in those areas where you are uniquely positioned you believe you can make a meaningful difference, even if it's hard.
I love it. So the right to win. And it's okay because, when we win, everybody wins in terms of the economics, the outcomes, the lives that are saved. So I think it's okay to be unapologetic about that. The conscious capitalist in me likes that.
Yeah.
Because ultimately, and I'm going to repeat something that Dr. Stephen Shaya actually said on a stage right here, is like, no margin, no mission, right? So
I like that.
We must, and in our team, we always say we're in the business of purposeful profits. So I think we also, as leaders, need to be bold and unapologetic about that because we got to keep the mission funded. Yeah. Therefore, have a fiscal responsibility to our shareholders and the markets so that we can keep doing research and making this better and better. Iron sharpens iron. Somebody told me once, yeah, but two pieces of dull iron don't sharpen each other. Therefore, why that obsession on excellence is great on all corners of the industry because it will make us all better as we sharpen each other. All right, so there's so many examples that I'm sure that you have of ways that you are working to partner with other stakeholders. We heard a few examples. Let me also rattle another one because we're involved in this one to some extent. Talking about first and winning and tackling, Novartis, probably the first pharma company to have a major, meaningful partnership with the likes of the NFL. And we happen to be working with the NFL as well. So it was like, oh, we're in the middle of this party. This is so cool. But anyway, I don't know if you were going to mention that one, but give us some examples or maybe or ideas into how you see these type of partnerships working, with other stakeholders. So you're bridging these gaps together and going at this, sharpening for better outcomes together.
You have to go where the people are. It's as simple as that.
Yeah.
And I think we've learned that over time, right? As an industry, you're trying to get people to come to where you are. It doesn't work. And so the NFL, it's amazing. I was shocked about the number of, not people, but women. It was one of the fastest demographics growing and watching the NFL.
In one year only.
Amazing. And that's one of the reasons people said, well, why did you do a breast cancer screening ad for the Super Bowl? Taylor Swift. Well, it's because we knew demographically so many women would be watching. Now, where was I during the Super Bowl? I always have a big Super Bowl party. I don't necessarily watch the game. But I don't know how many of you relate to this, in terms of like American football, but we're all in the kitchen and the guys are all like watching the game and we're all like, but that ad came on, right? It really drove a conversation between the families who were there, the men and the women who were there, and even my kids. My daughter was watching it on TikTok and she was like, oh my God, this ad is getting so much, I would say, polarizing comments, but that's okay.
Did you all see it? It's about boobs. Look it up. And that is said on the air. That's not just me being vulgar here.
But my daughter, right, was thinking about, well, Mom, when did you start getting a mammogram? When should I? My daughter's 14. When should I start getting a mammogram? So just think, driving that dialogue is very important. And obviously, these choices come down to the physicians and their patients, right? But if we can help be a catalyst for education and to drive the right dialogue, we're okay with doing that, So that's one great example. I want to talk about another one, and this is a population that's near and dear to me: newborn babies. And our SMA team back at Novartis. And so, SMA is a terrible disease and one of the top causes of infant mortality. And I'm so proud of what we've been able to do in partnership with the advocacy group there. They're so impressive in terms of, one, ensuring that newborn babies in the U.S. are screened. Almost 100% are screened because there's a time element here. You have to get to these babies. The team always says time is neurons. Time is neurons. And so we have to get to these babies right away, make sure that they're screened, and if they qualify for this one-time gene therapy, make sure that we can get that and access really quickly. And I'm really proud of the difference that makes, because you talk about vulnerable populations. There's no population that's more vulnerable than a newborn baby. And again, I'm really proud of doing the hard thing. That was a moonshot for us, getting into that space, and we continue to pioneer and say, what is the next thing there? Even as we look to, how do we help those who are over the age of 2 with SMA live better lives?
Wow, that's amazing. And fun fact, the population under 5 in the United States is already majority minority. So by definition, in itself, becomes an equity and disparities priority, not because it's the niche, but because it is the mainstream of babies.
Yeah.
So that just adds that other layer, hence why it's not just a program. This is to be embedded in a mindset in everything we do. Now, we talked about, and you mentioned the shareholders and Dr. Shaya's quotable phrase of no margin, no mission, or you need to be, otherwise we're not sustainable. But how do you quantify that? How are you measuring maybe the economics or the economic value of closing these gaps in the work that you do?
Yeah, I mean, look, the teams know this, we know this, and I love kind of like being unapologetic about this is a business. It is a noble one, in my opinion, because if you think about everything, and I won't say it's just the pharmaceutical industry, it's all all sectors working together in healthcare. What we've done over the last 50 years to change life expectancy, particularly in the U.S. and even over the last 100 years. And you think about each year of life, what does that mean? Provided it's healthy life, people are living longer and healthier lives. Productivity, what does that mean towards, even you can quantify it to what would that mean and project impact on GDP, right? And so healthier societies, it's not rocket science, it's good for the economy. And so look, you have to have healthy businesses for which investors want to invest in. If there's no innovation in the healthcare sector, and particularly the life science industry, they will take that investment somewhere else. It is a virtuous cycle, right? And so we focus on having healthy businesses, and because there's a lot of risk in life sciences. Many of our experiments don't work. What people hear about are the ones that did make it, but there are a lot of experiments that don't work in the discovery phase. Then more of them fall out in the development phase, and then those that get to approval and you get them to patients, are the real winners. And so I think there's many ways you can look at the economics of this. So one is the shareholder value return, right, from our R&D efforts, which is very strong for Novartis. The other is our impact for society. Each year, we impact about 300 million patients. That is nearly the size of the United States, if you think about that. And I'm super proud of that. And I think also this piece of your personal economics, I want to talk about this for a second. We talk a lot as leaders at Novartis about our personal purpose and our story, right? And I know for me, I talked about democratizing outcomes. But we often ask ourselves, and I ask the teams, what will be different because you were here? What is it that you're uniquely positioned to do? So you talked about the challenging times that we're living in right now. And it is not for the faint of heart. And it will also pass. And we will go into the next challenging time. And, my grandmother used to say, education is the great equalizer. And there's one that's more morbid than that. Death is also an equalizer, because we will all pass through this life into that at some point. And so I believe very strongly, how you live your life matters, and the meaningful difference that you make in people's life. What will be your legacy, and what can you look back on 10 years from now, 20 years from now, to say, that is different for others, for a population of people, for a scaled group of people, because I was in that position at that point in time. My team was there. These are the decisions we made. This is what we fought for. This is what we did differently, and that has sustained over time. I don't know how you quantify that. That's a personal quantification, but that's kind of like how we think about both. Yes, it is a business. We need to deliver for shareholders. We need to perform. We need to deliver with excellence. And what is that personal equity to you in terms of you're at the table? What will you do with that seat to make a difference for others? And you put those two things together, you get a very powerful performance and contribution from these life science companies.
Wow, I love that. Can we give her a hand for that answer? If anyone was having a down week or moment, I think just the privilege of being in this room, I'm hearing that challenge you just gave us of striving for that higher ground purpose. Sure, profits are great, the bonus at the end of the year, maybe that exit strategy executed for those of you founders in this room, but none of that matters if that thumbprint of legacy wasn't there. So thank you for that, because that kind of answers my last question, which is great, because then I'll open it up for the audience. But it was, words of advice for the leaders in this room. Everyone that is here, I believe very strongly, wasn't just accepted in some list of delegates. You're here for a reason, and a reason that maybe we don't even understand quite yet. So take that with great responsibility. I was just sharing with the table here how we had many names, and I had people sending me messages as late as last night saying, I didn't make the list. Is there any way we could attend? We're sorry, we couldn't admit everyone. So you're here with a mighty, mighty purpose. What advice do you have for all of us in this room, leaders in this room, in the context that we're living in this sector, and the responsibility we carry?
Yeah, I think when you look at the state of the world, you can become very dismayed, right? And it can feel overwhelming because you feel like even in these leadership positions, sitting in this room, the privilege, I'm one person. What can I really do to change it? And I think that's a flawed way of looking at it because it is a snowball effect. It is sometimes a game, and it's not a game, but of inches, right? That then starts to compound, and it does make a meaningful difference. And I love what you said about people who are in the room. And I said this when I accepted the Woman of the Year award, the HBA, because that was really around women leaders and women who are who are in their households who are responsible for the health of everybody. They are the chief equity officers of their homes, right? Because you're responsible for, your parents, your spouse, your kids, your pet, all of it, and yourself, right? And I say, you're at the table now. You're in the position you're in now. You're in the room now. And you can spend all your time worrying about, what's going to happen? I can't solve it. But what is it that you're uniquely positioned to do now, today, in your role where you have leadership, you have scale, you have influence? Because you are they. We are they. Who's they? It's us. And we are the stewards for the next generation. And even with all of our polarities and all of we cannot lose that in most cases, we all want a healthier society. No matter what your back, we all want to help. Where we disagree is how do you get there, right? And getting back to what is it that we all want, not only as leaders, as humans, right? As humans, what do you all want? And can we find a better way to figure out the how? Because unless we figure out the how together in our unique positions at the table versus being overwhelmed, we will all suffer and we will not leave the next generation better than we found it. And that is our ultimate responsibility, whether we're developing the next generation of leaders, whether we're trying to leave a healthier society for our children, and not just my children, for everybody's children. We've got to take up that mantle and do what is in our influence to do in our communities and in our roles. That's our responsibility.
Thank you for that. All right, we have 1 minute left, and I'll open the mic for one question. Yes, right here. Let me give you my mic. What's your name?
Thank you. My name is Eduardo Placer. I don't think that this is going to be a 1 minute answer, but we'll pose the question. So I was really moved by the topic of this, and I want to speak specifically about advancing health outcomes specifically for the LGBT plus community in this moment. And beyond even gender-affirming care, there are certain cancers and medical conditions that disproportionately impact the LGBT community. And when they are personally feeling under threat by the federal government and maybe state government, what is the role of the private sector in ensuring and advancing their health outcomes?
All right, so listen, when I was talking about equity for all, I see equity as human. That's me as a leader. I see equity as human. And so I believe the role of healthcare and life sciences is to ensure that people have an equal opportunity regardless of background, of sexual orientation, any of it, the same opportunity at health and life. And I think it is just that simple, right? Because we are humans, and I know that different diseases, you're right, affect different groups of people differently. But I think if we take it back to what I would say the higher order, is that none of that should preclude someone from having the same opportunity as the next person, even if they are different, at healthcare and a healthier life and a longer life. And I think that is generally the stance of the life sciences. We think about how can we help people, all people, live longer and healthier lives.
Thank you so much. Okay, we have, I wish we had so many more hours. Reshema, you've given us so much wisdom besides the better understanding of what a chief commercial officer does. Thank you so much.
I don't know, I should have people repeat it back to me.
And also, I think what I'm taking away, and I'll close with this, there were many quotable and memorable moments in this conversation that I'm taking for me personally. So with a heart of gratefulness, I want to tell you that I feel compelled to continue to do harder, better, to borrow that mighty mission of democratizing outcomes, to recognize that in a world of polarity, division, there is always a higher ground that we could probably all rally around. The how, maybe that's where the around the table discussion comes in, but the what we're striving for should be undeniably the fact that we want people to live better lives, healthier lives, ensuring that there is access for all. And the partnerships in this room can be a great, wonderful beginning for that to be reimagined. So thank you for inspiring us. Thank you for your role and leadership. And let's make sure to connect during the break. And may the mission continue.
Thank you so much for having me.